It's going to be a very informal, I guess, news conference. Casey Stoughton, Public Health Director, she'll make some statements. And then we'll just, we'll go in order. You guys want to ask questions of her, feel free to do so. And that'll be it. Thanks, guys.
Good afternoon. Glad to be with you today. Like Dave said, my name is Casey Stoughton. I'm the Director of Public Health. As of today, there are a total of 35,366 total cases of COVID in Potter and Randall counties. Today we had an increase of 51 cases. Yesterday an increase of 113 cases, and Tuesday an increase of 67 cases. A week ago, increases were in the 20s, and before that in the teens. Our total active cases are up to 554 active cases. The adult bed utilization at our hospitals are at 74.5%. ICU utilization is at 62.5%, and ventilator utilization is at 38.5%. Our 5-day new case average is at 63 new cases per day, and that's up from 19 new cases per day on July the 13th. With these metrics, we have moved into level orange. Level orange indicates that our community's hospital capacity is limited. We want you to have the best information to make wise decisions for you and your family. There are a number of resources at AmarilloAlerts.com, including locations and times for mobile vaccine clinics. The vaccination clinic at the Civic Center does remain operational, and we welcome you to seek vaccination with us at the Civic Center. The COVID-19 vaccine supply is plentiful, and our local pharmacies and doctors' offices are a great resource for vaccine and are great places to go if you have questions about the vaccine. Our team will restart press conferences next Wednesday at 11. We want to provide the community with the most up-to-date information. So join us next Wednesday at 11, and we'll be able to provide, again, more information. The report card is also available at AmarilloAlerts.com beginning today. Thank you so much for your time, and I'm happy to answer any questions that you have. Yes, sir?
How is this going to affect city departments? Are we going to see a decreased amount of capacity, being able to be in the buildings, things like that? I know you guys can't do mask mandates, but what could we expect from the city?
Right, so not currently there's no change to city operation, but we do again want people to have this information to know where our hospitals are standing so that they can make wise decisions for their family and their themselves.
Do you have information about how many hospitalized COVID patients in Amarillo are unvaccinated?
Yes, and there'll be more information about this on next Wednesday's press conference. Again, we'll have our whole team together. The doctors from the hospitals will be there, our CMOs, and Dr. Bell, our new health authority, will be with us. So more information to come, but I can tell you that as of yesterday, we had 41 patients in our hospitals, and only 2 of those patients had had some vaccination.
Can you say how much of this increase is related to the variants?
I can't. So we do know that the variants are circulating here in our community. We don't have information about the amounts of variant, but we do know that the variants are circulating here in our community. Our response doesn't change with that information. The tools in our tool belt are vaccination and masking, especially if you're unvaccinated. So those are our tools that we have, even with the variants.
And just a logistical question, for those report cards, are they going to be daily, and is the news conferences, are they going to be weekly?
So the report cards will be daily at Amarillo. You can find them at AmarilloAlerts.com. And then the news conferences, they'll be every other week on weeks opposite of City Council, but for the next 2 weeks we'll have a press conference.
Will those be in person or back to Zoom?
There'll be more information. I would imagine that they'll be on Zoom, but there'll be more information coming out to you.
In light of the governor's orders, what exactly does moving to status level orange give the city authority to do?
So the governor has been very clear on his expectation, and that guidance is out there for us. What this does is it gives our community, again, that status, like we know exactly where our hospitals stand. And so we can make those informed decisions about about our own vaccination status, about where, about our masking and about social distancing and about the size of our gatherings and those kinds of things. So we're definitely relying on our community to make those decisions.
And what recommendations do you have for the public?
Sure. So we have on Amarillo Alerts, and you'll see our chart that came out. So we have our status level charts, and so we're recommending many of the same, just exactly what the CDC is recommending and other agencies. And so unvaccinated individuals, we're recommending that they wear a mask when in social gatherings of any size, that they refer to the CDC guidance for travel, and certainly seek vaccination. Vaccinated individuals, masks are unnecessary in social gatherings where everyone is vaccinated, and they need to consider wearing a mask in social gatherings where there are unvaccinated individuals, and then to refer to CDC guidance for travel.
I know you said there will be more information that comes out. Can you tell us about the status at our hospitals? Is there right now concern about capacity, ventilators, and staffing?
So, we talked about that with those rates. So, at that limited status where we talked about our adult bed utilization at 74.5%, our ventilator utilization is at 38.5%, and our ICU capacity is at 62.5%. So certainly there is that limited capacity. So that's why we want our community to know that.
And in that same vein, can you kind of review why flattening the curve right now is so important?
Absolutely, that is our way through this pandemic, and so we can do those with those tools that we've talked about really since the beginning, through vaccination, through mask wearing, social distancing, good hand washing, all of those things that we've talked about for so long.
And I know that you talked about kind of transitioning out of the Civic Center for the clinic. Were there any changes because of this recent increase to that plan that y'all are doing?
No, so we will be moving to the Public Health Department on August the 6th to continue offering the COVID vaccine at the Public Health Department.
And then mobile vaccination clinics still pretty much?
Absolutely. So check AmarilloAlerts.com. There's a number of mobile opportunities on AmarilloAlerts.com.
Now, obviously, it seems like since you guys are moving to the public health department to give out the vaccines, we're not seeing a whole lot of turnout for the vaccines as of now. And you said not too long ago we're only around 40%. So do you think that we're going to continue to see spikes and increases as we head on into this autumn? Do you think that's something we're definitely going to have to be worried about?
Anytime we have larger groups together, there's an opportunity for transmission. And so, we want to make sure that our community has this information so that they can make those wise decisions. Vaccination is really our number one tool right now. So, there's a number of factors that go into that move from the Civic Center to public health, but that's the natural home for our vaccination clinic. So we're glad to be back.
Do you feel that the kind of the lack of vaccination, like we're only at 40%, 60% still of the city still needs to be vaccinated? Do you feel that that lack of vaccination is going to put us in a rough spot going into this autumn, especially as we're starting to see a rise now and we're only in mid-July?
Sure, it always plays a role, and the more people we have vaccinated, the better. So we certainly want to increase or encourage people to be vaccinated.
With school resuming, are y'all in communication with the local school districts talking about their back-to-school safety plans, especially with, kids K through 6th grade not being eligible to be vaccinated?
Absolutely. That's, certainly a priority of ours.
Is there communication about whether or not masks might be required for those kids not eligible for vaccines?
No, so the governor has been very clear in his executive orders, so that's not.
Just bouncing off that, what are the recommendations for those kids who are ineligible to get the vaccine?
So, again, those safety recommendations would be social distancing, masking, not going to school when you're sick. Those would be the public health recommendations.
So what would you say to people who maybe doubt vaccine efficacy rates because some vaccinated people are catching this virus?
Sure. So, really, the vaccine is a great insurance policy. It doesn't say that, no vaccine is 100%, and it doesn't say that you'll never get the virus. But what it does really protect against, and what that insurance policy is protecting against, is severe hospitalization and death. And so really that's what the vaccine is really targeted for, and it has a 94% efficacy rate. And so really that is a really great, this vaccine is really a good vaccine. And so would just encourage people to, if they have questions, certainly talk to their doctor about it. There's a wealth of information and a wealth of resources here in our community.
Sorry. No, I just want a clarification. I know he was referring to 40%. Is that still the number of people who are vaccinated in the community?
Right, we're just under 40%. So we increase about a percentage point every week or two. So, but we're still under that 40% mark.
When we look at that lower level of percentage of our population that is vaccinated, and we know that the vaccine does provide some protection against worse infections and hospitalizations and death, are we still concerned about vaccinated people with transmissibility, higher transmissibility rates for these, the Delta variant, UK variant, whatever we've got going around here?
So certainly not higher transmissibility rates, but if you do contract the virus, then you do have an opportunity to spread the virus, which is again why it's so critical that we have more and more people vaccinated.
And speaking of being vaccinated, obviously the older population, you said a couple of weeks ago, is doing very well in terms of their vaccination rates. But what's the biggest struggle in terms of those vaccination efforts? Where is the biggest demographic that hasn't been vaccinated, aside from the elementary school kids and since the 14-year-olds and what have you, or they're just getting vaccinated? Outside of those, where's the big demographic challenge?
So we certainly want to encourage anyone who's eligible to be vaccinated, but we had a real success at the beginning of our vaccination efforts when the vaccine was eligible to people 65 and older and those with chronic health care conditions. And so that was that's incredible. That's really exciting. And then as the vaccine opened up to more and more people and to more and more age groups, that's kind of when we see that 40%, and 40% is wonderful. Like, we're excited about every person who's been vaccinated. So I think, that's kind of where we have some of that work to do as a community, and that's all of our jobs, is just that kind of larger age group there.
So more so like the folks in our kind of demographic, or is it kind of like the 40-year-olds?
Yeah, so the state's data is broken out by like 12 to 50, and then we don't have there's big chunks, so it's hard to it's hard to pinpoint it. Yeah, they're really big age groups. Yeah.
So I know we've been talking about vaccines, but I just have a question about those. But can you talk to us a little bit about why there isn't more, I guess, focused data on how many of the variants are in the community, specific numbers regarding, like the how many are the Delta variant, how many are the UK variant and such?
Right. So that we've certainly talked about that. That information is that testing is done through what's called surveillance testing, and so there is each sample is sent to the lab, and then there is a threshold of there's a threshold that sample has to reach before the lab can send it on for variant testing, and so they have to for it to be able to, for those variants to be able to be picked up, and so they have to. So they only send a random sample of those samples to be tested, and so they don't. So it's not an apples to apples comparison. It's not like a one-to-one comparison. So it's really hard to say if we have, and we don't get that information. So we just know that yes, it is circulating. Yes, it was identified.
Sure.
We just don't have that information.
I know that there's counties around the state, and more specifically Lubbock County, who said, the majority of these cases are related to the Delta variant. So I guess, why isn't Amarillo, being more, have that information, I guess the majority of these cases are related to a certain
Sure.
variant or anything like that?
So we're certainly working with the lab and asking for that information, and hopefully, I certainly can't answer that question as to why another county has information.
When we send those off for testing, we actually have to like send them out, correct? So there's like, it's not an in-house thing, we have to actually send it somewhere, so it takes time
Right.
to get that stuff?
Right.
Okay.
When you mentioned, of those like 40 or so people hospitalized, 2 are vaccinated. When we're looking at the age group of people hospitalized with COVID, is it a certain age group right now?
That would be a great question for the hospitals.
It's something that we don't want to think about, but obviously moving into level orange is something that's a possibility on the horizon. Do we have a trajectory of when we believe we could be moving into level red?
So, we'll continue to watch the data and watch the numbers, and then, and that information is all on the dashboard. So, it's certainly there, to watch along with us. And so we will reevaluate every 2 weeks and make that change accordingly. But we are at level orange for at least 2 weeks, and then after that we will make an adjustment up or down depending on the data.
Do you have data for the increase in our number of active cases in Potter and Randall since the beginning of July? It looks like a pretty big jump.
Yeah, so I'd have to get that information to you.
Now, you mentioned you spoke to the hospitals earlier today, correct? Or recently?
We certainly visit.
Okay, so well,
Regularly.
my question was, more so, how did they sound? Did they sound worried? Did they have anything in their voice that kind of indicated that, they're worried about their hospital capacity based on, trends over the last couple of weeks?
Yeah, so with that limited capacity, like level orange is defined at, they were definitely supportive of this move to level orange and wanted our community to know that, so that they could, so that we could all make those wise decisions and certainly be more aware of the actions that we're taking.
You've said it so many times. We've heard so many public health officials say vaccines are our best tool right now. Is there anything that Amarillo Public Health or, our local leaders are doing to try to ramp up vaccine education, maybe reaching out to communities a little more?
Absolutely. When we go, to our mobile clinics, talking to people, sometimes, we may give, we give vaccine, but we're certainly talking to people and providing that education and answering questions and doing things. So it's always important to provide the education, and then they can, talk to their friends and family and so on and so on. So that's always critical.
Okay, so when we think back to the bad place we were in November and December, hospitalizations really full, the transfer process broken down, people being sent 6 hours away for treatment. Is it possible that we could end up in that same place if we don't take some proactive measures here?
Again, that's why we want to make sure that we have the information that's out there. We want to make sure people have the information, just like now we've moved from level yellow to level orange, so that we can stop this now. We as a community have the choice and have the resources to slow the spread, just like you mentioned earlier, to flatten that curve. And so we don't have to move to level red. We can now make the choice. We can do all the things that we need to do to slow that spread, so that we don't get back there. And so that's our goal in this conversation today, and all of the work that we do. So absolutely, that's our number one concern.
Casey, what specifically criteria changed that pushed us into the orange?
Sure. So the level orange is any adult bed utilization between 60 and 79%, adult ICU utilization between 60 and 79%, ventilator utilization between 30 and 49%, and the 5-day new case average between 50 and 79%. So it's all of the above. Yeah, we need to have hit at least three of the 4 indicators, but we have hit all 4.
And that's the same criteria as it was, that has not changed?
That has not changed, yes.
And do those numbers represent total bed usage, like for COVID patients and non-COVID patients, just an overall look at the hospitals?
Right, so that does represent the overall hospital, because that's, that's a very important, if the hospital is full, then the hospital is full. So we want to make sure that we're accurately depicting hospital capacity for our community.
What are the numbers
Sure. So our testing side is definitely picking up. You know, a week or two ago, we were seeing in the single digits every day, and now we're seeing at least 20 patients a day. So definitely picking up. And the vaccination clinic kind of ebbs and flows. So some days will be a little slower than others, but we have started to see a little bit of an increase, and we're hopeful for that, especially during this back to school time.
What kind of people are making up the new cases in general?
So it's really just, just a kind of a across the board, but lots that we have, a number of people who are kind of like less than 30. So
Do you know whether the majority of those are vaccinated, unvaccinated?
definitely unvaccinated.
Any other questions?
I have a few follow-ups here. So, obviously, I think a year ago, we didn't think we would all still be in the same place. Maybe you did as a public health official. What advice would you have to people who are so burned out and just want this to be over? What is the best way to move forward?
That's a great question. We certainly know that there's fatigue here in our community. I think the very best way to move forward is to increase our vaccination coverage, to continue to wear masks if you're not vaccinated. We've got to slow the rate of transmission here in our community so that we can slow the rate of the variants and the rate of that transmission, so that we just really don't allow COVID to transmit in here in our community.
In talking with Dr. Rodney Young at Texas Tech University Health Sciences Center, he told me a couple weeks ago, Delta is just showing us what variants are capable of, but the next one could very well get around the vaccines in a way that Delta is not quite doing. What is your expectation for possible variants if we don't get a hold on this quickly?
A virus's number one job is to stay alive, and they do that by changing. And that's what a variant is. It's a change in the virus. And so anytime that there's transmission, that virus has an opportunity to change. And so we're in kind of a, we're in a good spot right now before we get going too much, to increase vaccination rate for people who haven't gotten their second shot. Now is the time to get your second dose. For people who have been on the fence about vaccination, now is the time to go ahead and be vaccinated, so that we can slow that transmission, so that we don't give the virus an opportunity to change, so that we don't give that virus an opportunity to make a variant. Because you're right, the next variant could be really problematic. The variants that we're seeing are of concern, and so we want to make sure that we are able to stop that, especially here in Amarillo, Texas.
And we've heard the Biden administration call this now a pandemic of the unvaccinated. Would you kind of agree with that way of thinking right now?
I think that it's certainly a situation where we have a choice and we have an opportunity to make a difference, and so I think that that's an option, an opportunity that we have.
Now,
Any other questions?
I just have one quick one. We went from, being a vaccination hub to now being one of the 5 most unvaccinated areas. Is that kind of a frustrating 180 to have had, especially throughout all of this work and effort you guys have been doing to increase vaccination efforts and things like that? Is that a frustrating 180 to have?
Well, every vaccine that we've given is a life saved, and so I know that, our work has gone out even beyond our community, and so I'm glad that we were able to do that. I'm glad that we were able to provide vaccine for even other people, so that, because that's still a life saved. I am hopeful that we will increase our vaccination coverage rate here in our own community. I love Amarillo, and having grown up here, I really do love this community, and so I'm very hopeful that that instead of 1 to 2 percentage points every week, we'll see that grow tremendously here in the next little while. So definitely hopeful for that.
And this is kind of my last question here. We know that a majority of people who are still not vaccinated, maybe they're concerned about side effects or what it might mean for them later.
Absolutely. We've heard, we have lots of stories of patients who were very healthy athletes that now have pulmonologists that they have to see regularly. That, patients who may have been discharged but were discharged home on oxygen. And so, it's, that the virus is so dangerous, and can be so deadly that the vaccine is the risks are so minimal compared to the virus itself, and really many of those things that we hear is on social media and different things like that are really myths. And so I would encourage people to talk to your doctor, to look at reputable sources so that they have that information, have that comfort for themselves, because that's really important. And so certainly ask those questions, make sure that you're comfortable with that.